Can something as simple as hemorrhoids lead to significant complications?
How are hemorrhoids diagnosed and treated?
A physician who specializes in colon and rectal surgery will provide the answers on this week's Health Talk.
We're up next. Hi, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. On this week's Health Talk, we'll continue our discussion on hemorrhoids with Dr. Ryan Bendl. He's a colon and rectal surgeon with the Western Connecticut Medical Group.
Welcome.
Simple topic, but actually quite complicated, isn't it?
So, Ryan, start our viewers off a little bit by telling us what a hemorrhoid is and how they develop.
Yeah, so hemorrhoids are actually blood vessels and connective tissue that we're all born with. A variety of reasons, including constipation, childbirth, pregnancy, straining, some medical conditions like liver disease can cause our hemorrhoids to get enlarged. So because of that, there are a variety of treatments that we can offer patients, everything from over-the-counter or dietary or lifestyle changes, all the way down the line to surgery.
So Ryan, we all have hemorrhoids. That's normal, it's part of our normal anatomy. And some of us have habits or complications that lead to them becoming inflamed, painful, and enlarged. Well, how can we prevent them? What's the biggest one, two, or three things that we can do?
Really the biggest thing is increasing your fiber intake. So dietary fiber, if you can't get enough that way, it's recommended 25 to 30 grams of dietary fiber per day. Also staying well hydrated. If you can't get enough fiber through your diet, adding a fiber supplement is usually one of the first line approaches that we have toward most patients.
And this keeps the stools large and soft.
Yeah, exactly. It decreases the mechanical trauma of the stool going through the anal canal, which is where the hemorrhoids live, and in turn decreases the kind of the inflammation that sometimes it may cause.
And if you can prevent constipation, you prevent the need for pushing and the...
Yeah, again, that's one of the reasons why you may have an issue. Other things like pregnancy and whatnot, it just kind of comes with the territory, and sometimes hemorrhoids get better after pregnancy, sometimes they don't. After delivery, it also depends on the type of delivery. Vaginal births, for instance, may make them a little bit worse than a C-section. So there are a variety of reasons why that may or may not.
So someone who is chronically constipated, goes to the bathroom once every 3 or 4 days, produces a small marble-sized stools. Yeah. There are some people who that's their problem. Those are the people who are prone to hemorrhoids and should probably think about some added fiber.
But the biggest thing nowadays is stooling habits. So also the amount of time you spend on the toilet bowl. So people who are now on their smartphones, they, instead of getting on the bowl, doing their business and getting off, they're, updating their status or doing whatever they may do while they're on the toilet. That's leading to increase in hemorrhoidal issues.
Here's a question I just thought of, and it's a little bit on left field. But clearly, in our ancestors didn't have toilets, and presumably, I think they stooled squatting. Mm-hmm. Is there an advantage in terms of the pressure in forming hemorrhoids to stool squatting rather than sitting on a chair?
Nothing in the medical literature suggests that, but I do have several patients that actually swear by. One of them is called the squatty potty, for instance.
I saw that on Shark Tank, actually.
They, some certain patients find that it's easier for them. There are conditions where patients will have trouble, evacuating stool, and that condition is called obstructive defecation. That's it's kind of beyond the realm of the hemorrhoid disease. It's nothing that the hemorrhoids have caused, but that in and of itself may lead people to strain some more, which can in turn make the hemorrhoids worse.
At what point do you think someone who suspects they may have enlarged hemorrhoids, when should they come see a physician about that?
So if they're having bleeding, I would definitely seek medical attention sooner than later. Bleeding, while it oftentimes may be or oftentimes is the cause with hemorrhoids, it's not 100%. So we do want to confirm that that's actually the diagnosis.
That's really important for our viewers to hear, I think, because there are other really important diagnoses that can cause bleeding, and we wouldn't want to miss that.
Yeah, and there's even, whether it's benign anal diseases like something like a tear, or something more worrisome, which is like anal cancer, which is pretty rare. We still don't want to, I've seen patients at both ends of the spectrum trying to treat what they thought was hemorrhoids, which we could have either A, treated much quicker and they would have been better had they seen someone, or have something a little bit more serious to deal with.
Well, how about, I mean, there are over-the-counter ads actually, let me put it differently. There are ads for over-the-counter hemorrhoid medicines all over the TV set. They must be big business because they certainly do.
Absolutely.
So tell us a little bit about those.
Yeah.
Other than the fiber, which we all agree is helpful as a preventative.
Yeah, the way that those work, a lot of them is what they do is they try to decrease the swelling. So whether it's a wipe or a cream, may improve the kind of discomfort or burning someone may have. There's really actually no significant contraindication as long as we confirm that hemorrhoids are in fact the diagnosis.
So it's okay to use those?
Yeah, a lot of patients will come and see me after they've already tried those.
Do they work?
Sometimes they do, especially with burning or swelling. Patients could have relief.
Now, some of them have topical anesthetic in it, don't
Correct,
they?
And it's really the numbing medication which is providing relief. When it gets into, that you're having bleeding or the hemorrhoids are starting to bulge out, because we all have hemorrhoids from the inside which can stick out, or hemorrhoids that live on the outside, then a lot of times it's a little bit beyond what the over-the-counter medications can handle. Now, by seeing someone like myself or another, medical provider, we can give you just stronger prescription strength creams or suppositories.
Lower the inflammation.
Yeah, which may be
cortisone-like drugs.
Yeah, exactly. Hydrocortisone, suppositories or creams. Sometimes some stronger numbing medication than you otherwise could get over the counter.
What if those interventions aren't fully successful? What's the next step?
So the next step, kind of in our algorithm, if dietary or lifestyle changes haven't improved and some of the prescription strength creams or suppositories, we have a variety of in-office treatments. And actually, it's nice because they're relatively pain-free. Actually, most patients don't have pain from the procedures, and they're done in the office without any sort of anesthesia. And the reason is that these treatments are all
without general anesthesia.
Without any anesthesia at all. And the reason is because
that would scare the daylights out of me.
Actually,
no, really, explain that to
the reason is that most patients' symptoms are from their internal hemorrhoids. And actually, internal hemorrhoids have no sensation at all. So we can cut them, burn them, do anything in the office, and you shouldn't feel it at all. It's the hemorrhoids on the outside that are very sensitive and painful. So if we do what's called a formal hemorrhoidectomy, or we excise the hemorrhoids, then yes, that's something that we have to do with general anesthesia or some sort of IV sedation. But in-office treatments, there are a number, one of which is called sclerotherapy injection. We inject a cottonseed oil and a phenol. It's actually a combination which causes the hemorrhoids to scar down, and they actually shrink down. It's a foreign substance injected into the...
It's similar to what they do for varicose veins, I guess.
Exactly, yeah. Another treatment is called rubber band ligation. And what we do, if you imagine the hemorrhoid almost like a mushroom kind of coming off the wall of the anal canal, we actually put a rubber band around the base of it. And that in turn will strangle the hemorrhoid. So within a week to 2 weeks, that enlarged hemorrhoid will actually fall off. So one of the things with that is patients will say, or we tell patients that you should expect some bleeding 1 to 2 weeks after the procedure is performed when the hemorrhoid falls off.
Both of those interventions are usually one time?
They can be done a variety of times, and if we're doing rubber banding, for instance, we'll do those a couple of times. And the reason for that is our hemorrhoids typically live in 3 discrete columns. So we usually treat 1 column at a time. So it may require multiple treatments. Another option that's out there is called infrared coagulation. It's what people come to when they're requesting laser treatment. And it's actually, it's a heating probe, and it actually heats the hemorrhoids, and it causes a little bit of a burn or a char. And that in turn will also cause the hemorrhoids to shrivel up. Now, I know injections or putting rubber bands or burning, you would think that it would be very painful, but it's actually not painful at all.
How long do those interventions usually take in the office?
5 to 10 minutes, if that.
People must be surprised then at how comfortable it is, because I think sitting here even as a physician, I didn't realize there were areas of the rectum that were not. That were insensate, that didn't have the feeling.
Yeah, and usually, again, it's usually not our first line treatment, but most patients, will do one treatment, make sure that they're not having any sort of discomfort, or they're not feeling it at all.
How about a week later, as these things begin to fall off, or it doesn't get really sore or inflamed?
The biggest thing that I will sometimes see is patients will feel like a fullness in the bottom, but that usually subsides after 24, 48 hours.
What kind of aftercare does it require? Can people go to
Yeah,
work
how do you go
the
to the
same
bathroom?
day?
Yeah, but you still go to the bathroom normally. You could actually, we have a lot of patients that come in right before they go to work, and they go to work and go about their day. They drive normally. You know, certain treatments will have to be kind of catered if you're on something like a blood thinner. We probably wouldn't do a rubber banding if you're on a blood thinner, for instance. But sometimes that even is not enough, and that's when we get into some more of the surgical treatments. So surgical treatments can be anything from where we actually put the patient, you know, give you some IV sedation, and we go in and we do put some stitches, which are dissolvable on the inside, which is a little bit more painful, but not quite as painful as a full excision. And then another thing that we can do is actually called the stapled hemorrhoidectomy, where we actually kind of staple off columns, essentially remove a ring of hemorrhoid tissue.
Where are those procedures usually done?
Yeah, those procedures are usually done in the hospital under anesthesia.
And you've used the word columns several times, and I guess for a layperson, or even for me, I'm not quite sure what you're referring to.
Yeah, so if we were to look at a clock, for instance, the hemorrhoids typically, what we would say in the left lateral position, the right anterior, and the right posterior. So we'll say 9 o'clock, 2 o'clock, and 5 o'clock, essentially, if you're looking at a clock. As doctors, we don't like to refer to the clock perspective because you don't know if you're looking from the front or from the back. But yeah, left lateral, right anterior, and right posterior is usually where they are.
And when I was an intern, if someone said hemorrhoids, you'd say sitz baths, which is, for the people at home, they were literally soaking your rear end Uranus in 6 or 12 inches of water, I don't remember, several times a day.
Yeah.
Does that work? Is that also?
That's helpful in patients who come in with a thrombosed hemorrhoid, or they have a blood clot in the hemorrhoid. So a lot of times patients will come in, they'll say, I have an acute swelling, acute pain in the bottom, and what we'll do is when we take a look, we see that there's a grape-like or purplish discoloration, and that's something we could actually, you know, it's very painful for the patient, but something we give numbing medication in the office, and we will remove just under the local anesthetic, and oftentimes they're feeling much better, and they feel better quicker than if they just kind of let it go.
So at a very acute onset often suggests a blood clot.
Correct.
Go off and see your colorectal surgeon.
And I was just going to ask, why do those blood clots occur? And we talk about other bload clots, other places in the body sometimes on this show. And are those phenomena related?
No. So they can so a lot of times, long and the short answer is we don't really know why they occur. Sometimes it could be because of straining or because of dehydration. But the good news about these blood clots is that they're not the type that can break off and travel to your lungs or that can kill you. It's a very benign condition. It's a pain in the butt, so to say, but it's nothing that can kill you.
That's good to know.
And you can literally go in and, by taking the clot out, give people almost instant relief.
Yeah. I mean, they're still sore. Again, it's still an incision in a very, very sensitive area, but it's an improvement from what they've been, you know, suffering with the previous couple of days.
We have a little under a minute left. Was there anything else you wanted to make sure our viewers knew about the treatments or the surgical treatments?
No, I think, again, seeking medical, counsel early on. A lot of times, surgery can be painful where we remove the hemorrhoids, but that's usually a last option. And actually, most of the treatments that we do are in-office, painless procedures. Sometimes if there are external hemorrhoids, we have to kind of make a cut on the outside, but the majority, are painless procedures done in the office, and we can get you kind of back to normal after a couple of treatments.
And if there's ever a doubt, you always see the doctor, I think, about the diagnosis, because things can masquerade as hemorrhoidal symptoms and be more serious. And
correct.
Colon cancer is not something you want to fool around with. So I want to thank our guest, Dr. Ryan Bendl, for coming on the show, giving us a lot of maybe two more information we wanted to know about hemorrhoids. I'm being teasing about that. They're common and they're important.
Absolutely, and we'll see you next week on Health Talk.
Be well.